This is the video on the difference between a hemorrhage and a stroke. People often confuse a hemorrhage in the brain with a stroke, but these are two separate entities. Let's start with a hemorrhage. A hemorrhage occurs when a blood vessel in the brain ruptures and blood is released. The risks, survival, treatment, and outcomes all depend on the location of the hemorrhage and the size of the hemorrhage. One type of hemorrhage is an epidural hematoma. This is where the blood collects between the skull and the dura, or the coverings of the brain. As the hemorrhage grows in size, it strips the dura from the skull. This will cause a mass. The mass presses on the brain, causing headaches and loss of consciousness. On a CT scan, this will look like an ovoid shape based at the skull. The size and position of the epidural hematoma will dictate the treatment. Some of these bleeds can be treated conservatively without surgery. The best approach, however, is to operate and remove the clot. Another hemorrhage is the subdural hematoma. This is where the blood collects between the dura and the brain. This blood clot will push the brain out of the way as it grows in size. This type of hemorrhage can become quite big, as there is nothing putting pressure on it to stop the bleeding. On CT scans, this hemorrhage covers a large area of the brain along the skull. This situation requires immediate surgery. Yet another hemorrhage is the subarachnoid hemorrhage. This typically happens when an aneurysm ruptures. An aneurysm is a bulge in a blood vessel that becomes weak over time and can burst open. The blood sits beneath the dura in the arachnoid space. These hemorrhages tend to be small and cause problems by constricting the blood vessels around the hemorrhage. This type of bleed requires surgery to correct their aneurysm and prevent further hemorrhages. Bleeding can occur in the brain itself. This is called an intracerebral hemorrhage. This can be due to a vascular abnormality or to trauma. The treatment for this again depends on where and how big the clot is. A stroke can be considered the opposite of a hemorrhage. A stroke occurs when a blood vessel is occluded, either from a clot or plaque formation. Blood cannot get past the occlusion, and the brain that depends on that blood will die. The brain on a CT scan will show a lack of blood to that area of the brain. A person might have vascular problems in their legs, with a heart valve, or with an abnormal heart rhythm. These conditions can cause a clot to form in the blood vessel. With movement, the clot can break free and move throughout the vascular system. The clot can end up lodged in the brain. This will cause a pale stroke in the brain that has lost its blood supply. On a CT scan, the area looks dark as the cells are breaking down from a lack of blood. Another way a stroke can happen is from cholesterol plaques forming in the carotid artery. This will limit the amount of blood that can pass through the carotid, depriving the brain of the blood it needs. The symptoms of a stroke depend on where the stroke lies. A person can have a pea-sized stroke in the neocortex and not have any symptoms. This same pea-sized stroke deep in the brain, in the internal capsule, will cause the opposite side of the body to be paralyzed. Strokes can be treated medically with TPA in an attempt to dissolve the clot. If the person comes into the hospital within a few hours of the stroke, the clot might be dissolved completely. After a few hours, the risk of a hemorrhage rises with the TPA treatment. So, a hemorrhage is bleeding into the brain, and a stroke is lack of blood to the brain. This ends the video on hemorrhages versus strokes.